Ladies and gentlemen, Happy Chinese New Year. My name is Casey Howe. I'm a professor from Utah, Faculty of Medicine. I'm oral surgeon by training as well as an orthodontist by training. Today, during the Chinese New Year season, I'm going to share with you what are the 6 most common dental problems that I encounter during this festive season. The 6 of them. First is the toothache. Second, gum swelling. Third is oral ulcer. Fourth is TMJ pain. Fifth is digestive system. And last but not least is actually our general immunological system problem. So first of all, we talk about toothache. So as we know, our tooth actually comprise 3 layers. First layer is enamel. The second layer is actually dentine, and the third is actually our pulp chamber, which is innervated by blood vessel and nerve. So ordinarily, when we have a decay, there is no pain because enamel has got no nerve. But once it goes into the dentine area, which is innervated by nerve, that patient will feel sensitive, but it's not very pain. It comes on and off. But during the festive season, when we eat a lot of high sugar content stuff, so what the sugar will turn by the bacteria into a very strong acid. And acid actually has a burning effect. And this will then bore a hole through to our dentine and into our pulp chamber, which will hit the nerve and the blood vessel directly. And the bacteria then invaded all the way tracking into the tip of our root system, which will then cause acute pulpitis. And underneath is actually the inferior alveolar nerve, which supply the pain fiber and the blood into our body system. And this pain can then goes into our trigeminal nerve and cause severe headache. And that's why it causes severe toothache. So the second problem, it is not happen to the tooth, but happen to the surrounding structures of the gum, okay, or the tooth and the gum area, which in our term we call it the periodontian area. So the normal periodontian comprise the gum and the alveolar bone and the whole tooth, right? And this actually support the stability of the tooth. So when we eat a very high starchy and sugary food, what will happen is that it form a very sticky plug, and this will then stick onto our teeth as well as our root, and bacteria will then stuck into that, which we cannot normally remove it unless we brush it. And once it becomes calcified, we can't even brush it away. So what will happen is that, as usual, it will produce very strong acid, and this acid will now bore a hole directly into our gum. So when it goes into our gum, it would then penetrate through our bone and enter into our marrow space. Once it enters into our marrow space, it will then goes into our blood system. So what is contained in our marrow? Marrow is a place where our stem cell is being produced. Marrow is also a place where our red blood cell is being made there. It's a factory for our red blood cell. It's also connected to our central nervous system, like including our spinal cord also. So this is going to cause a whole array of our metabolic syndrome, which we are going to talk about that later on. And what is immediate problem in our teeth is that it's going to cause mobility of our teeth, it's going to cause swelling of our gum. And normally we thought that is due to heatiness, that we thought taking antibiotic or drink some what we call cooling tea is going to help. But it may help you on a temporary basis, but on the long term, once it enter into our marrow space, it enter into our whole body system, which will cause some long terms or chronic disease like diabetes, high blood pressure, coronary heart disease. It can even cause stroke, like even the CNS problem like Alzheimer's disease or the brain's problem, okay? Memory problem. Now, the third problem is oral ulcers. Now, what's our mucosa function is that our mucosa is innervated with a lot of salivary gland. So this salivary gland will produce water fluid which is flush away and neutralize the bacterial acid. At the same time, it contains a lot of antibody to help us to defend our body system. So when we do not drink enough water or we have too much food that actually suck up too much water from our system, and the food itself also wear and tear our oral mucosal epithelium, this will then cause ulcers. And this ulcer, once it's infected by the bacteria, it is very raw and very painful. It not only just one, it can be multiple ulcer. And this can be so painful that it causes sore throats also. So what's the fourth problem? The fourth problem is our TMJ problem. So TMJ is actually the joint here actually controlling the opening and closing of our mouth. So in between the two cartilage bone, there's actually a disc. And this disc is a lubricant like a pillow that is actually cushioned between the two bones. So when we have excesses of the movement, this muscle that is regulating the opening and closing is also overworking, and our teeth also overwork as we chew a lot and grind a lot. So all this excessive loading will load on our teeth, our muscle, as well as our cartilage bone and our disc, and it can cause inflammation of a TMJ, which will cause symptoms like unable to open the mouth wide or even close the mouth, or we have very painful when we chew. All right, and this is actually very bad. So coincidentally, this morning I have one patient who contacted me because of this problem. So therefore, when we eat, we have to eat in moderation. And the fifth problem is actually the digestive system. As we know, when the food enters from the mouth, it goes through our esophagus into our stomach and then go into our intestine, the whole digestive system. The whole digestive system actually has a balance of microbiome. We call it the balanced gut bacteria that normally regulate quite well. When you have excessive amount of intake of food, especially a high sugar content stuff, that it will invite a lot of bad bacteria, and this will then disturb the balance of the normal gut bacterial flora, and this will then cause problems like indigestion, diarrhea, constipation, or a lot of air, a lot of bowel movement. So usually patients will have stomach ache and all the problems related to the digestive system. All right, it also can cause leaky gut problem. Now the sixth is actually our immunological problem. So immunological problem, right, is our endocrine system, and in short, it means our hormone regulatory system, which is controlled in our pituitary gland in our brain. So normally, what control the blood sugar is our insulin and the glucagon. And then what control our sleeping, what we call the diurnal rhythm, is our melatonin hormone as well as cortisol. So when we do not sleep enough, when we have high sugar content, and then when our daily lifestyle is actually disrupted, it also causes an imbalance of our hormonal system. And this will cause a big fluctuation of blood sugar as well as our cortisol and melatonin balance. And this will then cause a weakening of our immune system, which will make it easily for us to have high fever, to feel cold and hot, to have a swollen lymph node, sore throat, and all the problems that we normally see, the common flu, cold and cough, sore throat problem that we usually see during the Chinese New Year. So ladies and gentlemen, now as we know, these are the 6 problems that we commonly see. So how to prevent them? First is that we need to brush regularly, especially more so during the Chinese Year when we eat after each meal. Second, we need to eat in moderation. Third is that reduce or cut off completely the sugar content. And fourth, no alcohol. And fifth, drinks lots of water. And sixth, and also very important, to sleep sufficiently. So I wish you during the Chinese New Year enjoy your bonding with your family member while preventing all these unwanted complications which may spoil your festive holiday. So if you like my program, I request you to like it and share with your friend and subscribe my YouTube channel. Thank you very much and wish you happy Year of Tiger. Thank you.